the South has Dr. Martin Luther King, and we are fortunate to have Dr. Makini King today to talk about behavior and mental health. Hang on to your seat. You're in for a treat. I'm Kimberly Warren, and you are watching TBN's Joy in Our Town. Dr. Makini King, how do you like that take? No pressure there,
none.
Comparing you to Martin Luther King.
I'll take you at your word.
Well, we're going to talk a little bit today about behavior health and what the Kansas City Care Clinic has to offer. So who is Dr. Makini King?
So I'm a psychologist, and I work for the Kansas City Care Clinic as their behavioral health consultant. And so what that means is I am the mental health professional in the general medicine clinic, and I catch people who might have mental health, behavioral health concerns, and get them to where they need to be. And then if they have, more mild concerns, I go ahead and can do brief treatment with them as well.
Wonderful. Now, broadly, the Kansas City Care Clinic is known for health care for underinsured and low-income families. And so they may not even know that this services are they can access these services for mental health. Who can access those? Who is your clientele? Do you serve the entire family, children, adults?
So right now we serve adults in behavioral health. And so as people come into the general med clinic, I would talk to them about the services that are available to them as long as they're a resident in the surrounding areas and they have mild to moderate mental health, behavioral health concerns, we can see them.
Now, you are the behavior health consultant, but this is not a new service with Kansas City Care Clinic, is that correct?
No, we've done behavioral health work for decades. This is the first, the first year that we've sort of started pushing this integrated program where all of the different departments, the general medicine clinic, our HIV and AIDS clinic, and behavioral health, and then case management all sort of work together to do sort of wraparound services to give the client and patient better care.
Why, again, is it important to have a team of people, and how interconnected are our physical ailments with what's going on mentally and emotionally? What came first, the chicken or the egg, too?
Yeah, so those are, I think you're definitely right. Those things are interconnected, and one impacts the other. Our physical health is impacted by our mental and emotional health, and vice versa. It depends on what, on the individual and which one comes first. There's a genetic component for mental health that makes you more likely, puts you at increased risk for some mental health disorders, and those can be exacerbated by physical ailments. And similarly, when people have disruptions in their physical health, that creates a lot of stress, and that can contribute or exaggerate mental and emotional health for people.
Dr. King, before the show began, you told me you went to school in New York and Georgia. You've been all over the world. Why did you come back to Kansas City, and how are the struggles we're dealing with here with healthcare and with our total well-being? How is that similar or different to what? Are we the only ones dealing with these issues?
Absolutely not.
Where are we compared to the rest of the world?
Yeah. Well, to answer your first question, I came back to Kansas City because this is my home, after all, and
thank you for doing that.
Yeah, but we're an urban environment, and our care clinic is located in the city.
On Main Street?
Or on Broadway.
On Broadway,
yes.
Right, okay.
Yeah, so, and we like to promote ourselves as serving our surrounding environment, and so, with an urban area comes a lot of issues, around access, environment, poverty, things that really can contribute in a negative way to people's health, physical and mental. And so I think that we try to meet those needs for the clients and patients that come through.
So how are we faring against other communities? Do you think we're unique? Do you think it's more intense located in this community in Kansas City area?
Compared to other cities in the country?
Right.
I think it's probably something that all urban areas around the country are struggling with, getting access to care and for patients and clients.
Specifically with families of poverty, and I'm sure you probably see a little bit more of that in your care clinic because of the nature of how you're designed. How do you start the dialogue that this needs to be a priority compared to struggling to keep the lights on and
absolutely.
I need something done to my car, I don't have transportation? How do
Right.
you make mental health a priority? How do you do preventative care for people with poverty?
So those are real issues. I mean, that for the people that come into the clinic, mental health may not be at the top of their list of things, that they want to address, given that, they're trying to feed their families and get to work. We try to emphasize the importance of mental health and emotional health, and as well physical health, in order that they are able to better take care of all of those more pressing needs. Because when you aren't addressing your mental health and your mental well-being, you won't be able to tackle your day-to-day tasks, and in the end, it ends up hurting in the end. Again, I said we had sort of wraparound services, so wherever the person comes into the clinic, I think we all do a very good job of trying to emphasize taking care of yourself and doing those preventative things so that you can handle the other business that you have. Yeah.
A lot of times mental health professionals, behavioral consultants as yourself, may only see one person in that whole family continuum. How do you encourage other people to come in, and are your sessions just always one-on-one, and do you eventually include perpetrators and the moms and the dads and blended families?
We do definitely individual therapy and treatment. We have some groups going on right now for substance use, substance abuse, and then a support group for HIV and AIDS patients. We see families on occasion and couples. Eventually, at some point, we will start to see children as well.
We're going to put some information on the screen for our viewers. When we come back, we want to ask you, are there any quick steps or 3 things that you can give someone who is facing life-threatening illnesses, and how they maintain control over their lives and have hope, as such as people with HIV or AIDS, or just situations that may not get better right away. If you're just now tuning in to TBN, Kansas City, St. Joseph, our special guest is Dr. Makini King, and she is the behavior health consultant for Kansas City Care Clinic. If you would like to contact them or find out more information about their services, they have many wraparound integrated services for those that are economically disadvantaged, may have insurance, may not have insurance, but the information is up there for you. Dr. Makini King is the consultant, and the Kansas City Care Clinic is the entity at 3515 Broadway Street, 3515 Broadway. That's Kansas City, Missouri. They do so people on the Kansas and Missouri side. Their main number is there, 816-753-5144. That's 753-5144. So everybody's looking for a quick fix. I know it may not be one. On social media, there's a flyer going around, or a photo that says, "Hello, I want to reserve a suite for the whole family." So what 3 steps can you tell us? And it may not be 3, it may not be a magic pill, but for those that are spiraling out of control, where do we start?
I would say to be aware of how you're doing physically and mentally, and don't just brush it aside because you need to you have other things to handle. Just being more in tune with what you may need, and then asking for help. And that, there is a stigma with behavioral health, but we all need help. And, our services at Kansas City Care Clinic are there for that specific purpose. And if those needs aren't addressed, don't get addressed, get brushed aside because, we prioritize food and work and things like that. That can take a toll on ourselves and the people that we interact with, our families. So, So I would say being aware, attuning to what your needs are, your mental, emotional support needs are, and then going to get those services.
Wonderful. Great tip. You're not charging me for this, are you? Okay. The other thing I wanted to ask is, specifically in the Kansas City area, in the last, several weeks, we've been seeing violence increase, particularly with young males that are angry, that are not managing their stress, in an acceptable way, and they're hurting other people, if not taking their lives. What do you have to say to those people that are watching today that feel like nobody cares? I have stuffed this long enough, and now I am angry and I am mad, and someone's going to have to reckon with me.
They're not alone. We all go through things in our lives, some more than others, and that help is out there, and people do care about them. I always emphasize that with patients, because a lot of times when they have behavioral and mental health concerns, it does feel like, you know, you're really alone. But just to support them and validate that they're not alone, and that, you know, we really do care and we want to help you and we want to keep you safe. So,
is there a magic moment or Richter scale to say, I'm out of control and I need to go in for a screening, I need to access these services? How do you know when it's just you're having a moment and then I need some intense therapy?
I would say that if you were asking yourself that question, then it's time. I mean, it's good to catch it long before it gets to that point. But any time that a person feels like there is some disruption in their life that's making it harder to function, that's the time to go get help.
Okay.
Don't wait till it's, you know, you're at the cliff. Get to some services long before then.
Good. Now, for those that are ready to call, tell us about the process of becoming a client and being screened, and how you try to speed that up so we actually get to the meat.
So you can, if you just know that you have behavioral health concerns, you can just ask for behavioral health when you call the clinic. For people who want to, you know, enter through another clinic like in general medicine and see a physician, that's where I work. And so if you have an emotional, behavioral, mental health concern, that's where I would meet with you and determine what your needs are, what I can help address, or if you need longer term outpatient services, then I would set you up with our intake specialists who would do the screening to get into our behavioral health program.
Wonderful. What is the ultimate goal and what is your vision for this program? Because it seems like as we publicize the information, you may have more and more people coming in. So what is the ultimate goal?
To get care to people who need it. And for us, I think our model is about teaching people the skills that they need, that they can manage stress on their own. So when you come in, it's not, you know, we don't want people to be in therapy forever. We want to teach them the skills that they need, the coping skills that can help them manage, you know, when things happen, as they often do.
Are there any success stories out there?
Oh yeah, absolutely. Yeah, more often than not, I would say that once just the whole act of saying, hey, I need help, I think that's a success, you know, because they're then taking the steps. Even as hard and as vulnerable as it is to say I need help, that is a step in the right direction.
Is there a face on those that need help, or is it pretty much everybody in society?
Well, I mean, my theory is that we all need help. There's not a particular type of person that, you know, needs behavioral health more than others. I think we all do.
Wonderful.
Yeah.
Let's put that information on the screen again. Again, this is Dr. Makini King with the Kansas City Care Clinic. You can reach them by calling 816-753-5144. That's 753-5144. They are located at 3515 Broadway in Kansas City, Missouri. They also serve people from the Kansas or the Missouri side. So we want to thank you, Dr. King, for being here today and keeping us all emotionally balanced. Come back again.
Okay, thank you.
We want to thank each of you for watching TBN Kansas City St. Joseph. I'm Kimberly Warren. Have a wonderful week.
TBN TV16 would like to encourage you to partner with us in collecting turkeys for a local outreach ministry, Food for Kids. Food for Kids, located at 19th and Massaini in St. Joseph, is in need of 450 turkeys to pass out to needy families in our community this year. The turkeys will be frozen until distribution on November 6th. Please contact Food for Kids at 713-514-2843 for more information. This outreach is a part of TBN's His Hand Extended Ministry.
studies have shown that early childhood learning is a critical factor in marketability, self-confidence, self-discipline, and the list goes on and on. Today, we have a special guest that is facilitating learning and the Learning Coalition. It is called the Mid-America Regional Council, and our special guest is Jim Caccamo. I'm Kimberly Warren with TBN. Hang on to your seat. You're in for a treat. Jim Caccamo, welcome to the show.
Good morning, Kimberly. I'm glad to be here.
It is great to have you. Tell everyone who may not know, we already have many people that know in the community what you all do, but those that may be hearing about this for the first time, what is the Mid-America Council or the Mid-America Regional Council, Mark?
Well, the Regional Council works within the 9 counties in metropolitan Kansas City and with municipal governments, and we work on issues that affect all of us. So, for example, Homeland Security, transportation. Mark is the transportation planner for the region, and so on. What I really pay much attention to at M.A.R.C is the Department of Early Learning.
Okay.
And in the Department of Early Learning, we provide Head Start for Clay, Platte, and Jackson counties, and we provide what's known as the Metropolitan Council on Early Learning, working with the communities in trying to improve the quality of and access to early learning for children. Yeah.
Well, M.A.R.C is not a novice at doing this. How long have they been around our community and region?
The Metropolitan Council on Early Learning has been around 25 years, and M.A.R.C, I think 35 or 40 years. They've been around a long time.
Wonderful.
Yeah.
Who comprises this regional council? Who comes to the table and leans in?
Well, the people that come to the table and lean in are municipal governments, and they do a great job of coming to the table. We have a board of 33 elected officials. We meet monthly with the board. And we have a great deal of leaning forward. I like that idea. Leaning forward and being engaged in civic issues around the metropolitan area.
Many people that don't see the day-to-day work of our legislators and government officials may be surprised that we're not only talking about the economy and the roads and crime, but why is early childhood learning a hot topic and one of the top priorities?
Well, what we know is that when children come and knock on the schoolhouse door, they need to be prepared to be successful in school. And you know, our society has changed dramatically in the last 25 years or so. We have more 2-parent households where both parents are working. And I don't know about you, but when I get home from work, I'm exhausted. And so, it isn't the day like 50 years ago when mom was at home and dad was out. We're both out working now. And there are many, many single-parent families where the children probably don't get as strong as engagement as if there were a 2-parent household, but parents do very well. And so what we find is that there are lots and lots of children who come to school not prepared. And so the issue of early learning is to provide what I'll call some practical services like childcare. So mom can go out and work and dad can go out and work and the child is being responsibly cared for. But in addition to that, also looking at specific learning issues, vocabulary, numbers, what we call executive functions, being able to get along and follow directions and all of those things. So those are things that 50 years ago, mom taught us, or, we lived in a community where our aunts and uncles were close and so on. So we have a different society now. And what we're finding by the research is that children who are in high quality early learning programs really knock on the schoolhouse door ready to rock and roll.
Wonderful.
Yeah.
Jim, there are so many different objectives that M.A.R.C is trying to reach and obtain. Where do you start in prioritizing early childhood education? You talked about jobs, you talked about maybe healthcare and transportation affects that, and M.A.R.C is very concerned about transportation and access. where do you start in setting up the goals and objectives and say this is going to be the top priority within this whole system?
Yeah, it's a very good question, and there is no easy answer. One of the things M.A.R.C does is to listen to the community. So, for example, with early learning, back in the mid to late 80s, the community came to us and said, we don't have enough quality early learning programs. Is there something M.A.R.C can do to help us? And so when the community comes and asks for support, we try to respond, and we were, very, very interested in responding to that because of its importance.
As a facilitator for learning and for early childhood learning specifically, how do you engage the parents? I know at the table you have a lot of civic-minded people and organizations and government. How do you enrich, engage, and empower the family so they're also at that table?
Well, the first thing I would say, Kimberly, is that parents want to do the right thing. They love their kids, and they want to. So it's not like I have to twist your arm to get you to be engaged. Parents are really engaged, and parents are really caring. What we try to do is to give them some ideas of things that they could do. So, for example, do you read to your child every day? Well, I don't read so well myself. That's okay. You can get the book. Look at the pictures, read the words you can read, tell the story. You don't have to read the story, you can tell the story. And those are the kinds of things that really kind of support and help parents. I remember recently I made a visit to a home, and the mom was sitting on the floor with the kid. The kid was 4 years old, and they were sorting the laundry. And she was doing things like, what feels rough? When you touch it, it feels rough. And the kid was bringing up, the wool socks and those kind of things. Can you put all the red ones together?
Oh,
I mean, things like that, things that you do in your everyday life without really thinking about it. You just do it. Well, children don't know just do it, so you have to teach them, parent them in learning that. So, but parents are great, and we learn so much from working with our families. We really do.
What it sounds like, Jim, is the parents may not have to go and buy a home curriculum and feel like they have to be the teacher, but it's naturally embedded in everyday life?
Absolutely. Absolutely.
Wonderful.
Yeah.
If you're just now tuning into Joy in Our Town, we are really fortunate today to have Jim Caccamo here, the director for the Department of Early Childhood Learning. We're going to put information on the screen if you want to go to their website or give them a call and see if you can lean in and be a part of this process to facilitate learning in our community and schools. The name of the company is M.A.R.C, Mid-America Regional Council, and they are located at 600 Broadway. They have a number that you can contact them. It is 816-474-4240. Their website is www.marc.org. That's marc.org. We want to ask a little bit more about the Head Start programs and what some of their goals and objectives are, and how we as a city can be a part of the mission and how it benefits the community.
Well, let me tell your viewers and you just a little bit about Head Start. Head Start started 50 years ago, and it was under the Johnson administration. It was focused on helping very low-income children to get a head start in learning to be prepared for school. It started as a summer program and grew. So it's been around a very long time. We're celebrating, as I said, our 50th birthday. And we are what's known as the grantee in Clay, Platte, and Jackson County. So we sort of oversee the process. We serve about 3,000 children and families in Head Start and early Head Start. And it's really remarkable because we believe, back to your parent question, we believe that parents are very important. And so at least 51% of our policy council who give us direction have to be parents. And it's just wonderful to engage parents. And we believe that parents can be leaders, not just in their family, but in their community. And so we do a lot of training with parents about things like Robert's Rules of Order. How do you run a meeting? Those kind of things. And we're very, very actively engaged with those 3,000 children.
Wonderful. Now, at what age do you usually see a child enter the Head Start system?
Well, Head Start has really two phases. One is called Early Head Start that works with pregnant moms all the way up to about age 3. So infancy, toddlerhood, and then when they reach age 3, they go to Head Start. So it's not Early Head Start, it's Head Start. And those are kids that are 3 and 4 years old before they turn 5 and go to kindergarten.
Wow. Tell us how Head Start has really reached beyond what happened maybe 50 years ago, and now they are engaging students with different language backgrounds or language barriers.
Absolutely, with disabilities. I mean, we serve children with disabilities, and we have, because Kansas City is a metropolitan area, we have a wide array of children and families from all countries you can think of. I mean, it's great.
3,000 kids,
Yep.
that should be remarked upon.
Oh, I know every one of their names.
That is wonderful. Well, what are your goals for the future? You have 50 years under your belt with the Head Start program, many years with M.A.R.C or the Midland, the Mid-America Regional Council. What are the goals for the future? If the world were yours, what would you see happen?
Well, if the world were mine, I'd have available for parents access to very high quality early learning programs for every child. Every child.
Every child.
And that would then help us ensure that every kid who came to kindergarten was prepared to learn. Because I think our schools do a good job. I think part of the problems that they have is that there are children with gaps. And if we could close those gaps early, we'd solve a great deal of problems. So I'd do that if I were king for a day. That's what I'd do.
Wonderful.
Yeah.
What are some of the implications that being involved in the early childhood programs have upon the economy and the workforce and academic success?
Well, there's lots and lots of research, Kimberly, about the outcomes. And we know from very, very credible researchers, we have Nobel laureates and research people who do lots and lots of research. And we know that for every dollar invested in early learning, there's a $7 return. That's pretty dramatic. We know that kids who have high quality early learning programs finish high school more often than kids who don't, stay married longer, have less crime involvement. So when you stop to think about those kind of things, that's a lot of money that's saved because children and families are supported and get off to a good start.
Wonderful. Jim Caccamo, come back again. And we thank you for being here. And we thank you for watching Joy in Our Town. If you would like to get in touch with M.A.R.C again, they have a number that you can contact them. It is 816-474-4240. Their website is www.marc.org. That's marc.org. I'm Kimberly Warren. Thank you for watching TBN Joy in Our Town.
This program has been sponsored by the Trinity Broadcasting Network and made possible by your telephone dollars. Your continual support can keep Joy in Our Town brought to your home every day. So write Joy in Our Town, P.O. Box A, Santa Ana, California, 92711.